What if the real reason so many people feel stuck in therapy isn't a lack of willpower, but unresolved trauma that traditional talk therapy just can't reach? And what if there was a way, backed by emerging science, to break through that bottleneck? Let's start with the hard truth. For millions, therapy can feel like running on a treadmill. You show up, you talk, but deep-rooted pain stays locked away. This isn't just frustrating, it's a bottleneck that keeps people from real healing. Unresolved trauma can shape our lives in ways we barely notice, quietly fueling anxiety, depression, and self-sabotage. And when therapy stalls, it's not always because you're not trying hard enough. Sometimes the mind's defenses are just too strong for words alone. That's where psychedelic-assisted therapy comes in. Now, I'm not talking about recreational use. This is about carefully supervised sessions in a clinical setting, guided by trained professionals. Here's what's fascinating. Substances like psilocybin and MDMA appear to temporarily quiet the brain's default mode network, or DMN. Think of the DMN as your mind's autopilot, constantly replaying old stories and self-criticism. When it quiets down, people often describe a sense of openness, like stepping outside their usual mental loops. Clinical trials suggest this state can boost neuroplasticity, meaning the brain becomes more flexible, more able to form new connections and let go of old patterns. And here's the kicker. Instead of daily medication, some studies report significant improvements after just a few guided sessions. That's a radical shift from the status quo. But with promise comes responsibility. Psychedelic therapy isn't a magic bullet, and it's not for everyone. Safety is paramount. Rigorous screening, medical oversight, and therapist training are non-negotiable. Regulation is still catching up, and stigma remains a real barrier. Many people still associate these substances with counterculture, not clinical care. But as research grows and more clinicians get trained, the conversation is changing. So here's the question. What if the future of mental health means moving beyond daily meds and endless talk, toward targeted, transformative experiences, always with safety and science at the center? I'd love to hear your thoughts. Where do you see the line between breakthrough and risk? Let's talk about it.